Action. Hi, this is Nancy and Brenda with a hospice care plan. Today we're going to talk about positioning a patient, and this is Pete. He's going to demonstrate how we can position him for the best, most comfortable and optimal breathing.
So he's flat. He's a big guy. He's kind of struggling breathing. The first thing you want to do is make sure that he's up in bed as high as he needs to be. His feet aren't, so basically his hips where the bend of the bed is the most optimal. And before we raise the head of the bed, we're going to it's called winging his elbows or getting his elbows out. So here the lungs are smaller than here. So we're going to do that for Pete in bed.
We're going to keep his arms away from his chest so it has room to maneuver. It has room to expand.
So now that his hips are high, his elbows are out, and now we're going to bring his head up a bit.
And notice that what's going to happen here is his abdomen is going to slide down with gravity, which again is going to improve the volume of his chest.
And even if he was rolled on his side, you could tilt him on the side in the same position, but keeping those elbows out opens those lungs to their maximum capacity.
Even with this type of good positioning that he's in now, some patients who have lung disease or are having problems breathing have to be put into a more emergent breathing position to help them. So what we're going to do is we're going to go a little further than the general position. We're going to bring Pete up really high so gravity can help drop his diaphragm down. We do have his arms supported, but right now, we almost want him to be able to lean forward to help his chest be able to move forward. And I think that's about as far. Notice that we've got his knees flat, so we're not crunching him with the legs up. We're going to use we don't have another pillow, so we're going to use what we've got. We're going to take this comforter and make it into a big pad, and we're going to say, if you lean forward, Pete, you might be able to breathe better. So we're going to lean you forward, support his back, and really bring him so that his chest can open as much as it can forward. If a patient is able to, you can even have them swing their legs to the side and sit up on the side of the bed.
So a lot of rooms have fans, or you can put a fan. Having fan come toward the face can be very helpful. That the air on it helps stimulate breathing and it causes relief. It's a good time to look at your instructions in the hospice care plan under the breathing section. If they haven't had a nebulizer and they have one, that's a good time.
If they have oxygen, make sure that it's on. There's no kinks in the tubing, and then it's on the correct setting that your hospice team has arranged for you.
Yeah, and always focus on how he's feeling, not on the oxygen saturation number. Lots of people have an O2 monitor at home, but it's how his breathing is. So positioning, fan, oxygen, be sure to medicate. And often when the body can't breathe, the first thing that happens is you become very anxious. And so you may often need to use the anti-anxiety medication along with the medication for breathing.
Generally, if you've tried all the things that Brenda and I have done, he's in his optimal position. And as you said, you've given him all his routine medications. He's still uncomfortable. That's when you go to the as-needed medications. And if that's still not helpful, what do? Call your hospice team.
Yes.
Thank you. This is Nancy and Brenda with the Hospice Care Plan. Please go to our website and our YouTube station, the Hospice Care Plan. We've got lots more there for you.
And you can get one of our booklets from the hospicecareplan.com.